Hi, I'm James Gervais, an Associate Sales Rep with Neox, and I'd like to thank you for giving me a few moments of your time to talk to you about Neox Core 1K. Now, a little bit about Neox. We were founded in 2011 and are dedicated to developing and bringing to market regenerative therapies processed from umbilical cord and amniotic membranes to the orthopedic and wound care professionals. A little bit about our parent company, Tissue Tech. It pioneered the development of a proprietary cryopreservation technology, Cryotech. Now, this preserves the innate biological and structural integrity of the natural placental tissues. The CDC's Nation Diabetes Statistics Report 2020 stated that 34.2 million Americans have diabetes and 88 million American adults have prediabetes. Now, having members of my own family, particularly my mother, aunts, and uncles, suffer from diabetes, I've seen how this disease affects the lives and the costs that are both physical and financial for the patients. Now, it's been reported that in diabetic patients, approximately 15% will develop a diabetic foot ulcer, with 6% being hospitalized due to infection or other ulcer-related complications. In a retrospective study of cryopreserved umbilical cord amniotic membrane tissue for the treatment of a diabetic foot ulcer by Dr. Alan Raphael, 29 patients with 32 wounds were treated at a single healthcare center. Of those 32 wounds, 28 achieved complete epithelialization of an overall healing rate of 87.5%, an average wound closure time of 13.8 weeks, and an average of 1.68 CUC applications. Now, the results suggest CUC allograft may be effective in improving the healing of DFUs, as well as potentially reducing medical costs associated with chronic DFUs due to the low number of applications needed to complete wound closure. Now, Neox's Neox Core 1K is a cryopreserved umbilical cord and amniotic membrane that has been indicated for chronic wounds such as DFUs. Neox Core 1K is up to 10 times thicker than amniotic membrane, and this may increase the longevity in the wound bed, and it has demonstrated consistently high closure rates, reduced inflammation, while promoting healing and regeneration of tissues. Dr. Raphael stated in a study that UC and AEM tissues have unique glycoprotein complexes that have been demonstrated to be anti-inflammatory and anti-scarring therapeutic actions, including inhibiting cell adhesion and proliferation and inducing apoptosis of pro-inflammatory cells. With the proprietary Cryotech process, many of the perceived drawbacks of cryopreservation have been minimized. Neox Core 1K has a shelf life of up to 2 years without compromising the structural or functioning of the allograft and can be stored in a standard freezer. There is no need for a deep freezer. The thaw time is 5 to 10 minutes, while in a package that utilizes a double sterile barrier. The product can remain viable for up to 6 hours once thawed, and if Neox isn't used or been removed from the packaging in those 6 hours, it can be placed back in the freezer and used at a later date. Once thawed, Neox, due to the Cryotech process, maintains its hydration, and the optimized thickness makes it easy to handle and suture. And now, just to kind of circle back to Dr. Raphael's study, the overall healing rate for the patients was 87.5%, which is higher than the historical published standard care DFU healing rates and other advanced therapy modalities. In addition, the number of wounds achieving complete epithelialization was 60.7% by 12 weeks and 89.3% by 24 weeks, compared to 24 and 31% for historical published SOC data. Now, the results suggest the use of CUC allograft may help improve healing for chronic wounds, such as DFUs, and with only an average of 1.6 applications, reduce the overall cost of treatment and improve the quality of life for the patient, which is the end result, which is the end goal, I should say. Now, with that, I'd like to thank you for your time, and if you have any questions, I'd be happy to answer them for you.